Welcome to my instructional video on otitis externa. My name is Melissa Lagunas. I will be describing the condition, how it happens, how to treat it, and how to prevent it from happening again in the future. You will also see a demonstration on how to instill eardrops in the ear of the affected individual. According to the case study presented, this is a 16-year-old male. Jay is 16 years old and is on his high school swim team. He complains of sudden onset of right ear pain that worsens at night. He says the pain intensifies when he touches his ear and he has a feeling of fullness in the ear. After seeing his provider, he was diagnosed with otitis externa. The patient has been prescribed ear drops. A family member will be administering the drops for him. Otitis externa is also known as swimmer's ear. It is inflammation to the external ear canal, usually with signs and symptoms of infection. It can involve outwardly to the pinna or internally to the tympanic membrane. It affects both adults and children. Otitis externa is usually bacterial in origin, with one or more bacterial organisms involved. The usual bacteria involved are Staphylococcus aureus or Pseudomonas aeruginosa. It is less likely caused by fungal organisms. Otitis externa can be a result of excessive or frequent moisture in the canal, such as from swimming, continuous exposure to high humidity, and excessive sweating. Moisture can also be retained in the canal from the use of hearing aids. Trauma can lead to otitis externa in that introducing a foreign object into the ear, such as a Q-tip, fingernails, bobby pins, matchsticks, etc., can cause damage to the skin. Continued exposure to heat can cause loss of earwax, which is necessary to the ear because it is an acidic protective barrier that protects the ear from bacterial and fungal growth. Earwax is also medically termed cerumen. The structure and physical environment in the ear canal is also a risk factor for otitis externa. Obstruction leading to fluid retention can be seen in a person with a narrow or very hairy ear canals. Too much earwax can cause fluid retention, and too little earwax makes the skin more vulnerable to infection. Immunocompromised individuals are also at risk since they are more vulnerable to infection than other individuals. A break in the skin in the ear causes inflammation and makes the skin susceptible to infection from a bacteria or fungus. This causes inflammation to the tissue, which leads to obstruction of the various glands in the ear canal. Pruritus or itching then follows. Itching will lead a person to scratching the affected area, thus causing more damage to the skin. The cycle will then continue if not treated. This cycle leads to a change in the environment of the ear canal, causing the skin pores to open, causing more inflammation. The ear canal becomes warm, moist, and alkaline due to an increase in the pH from the loss of quantity and quality of the earwax. These three factors provide the optimal environment for organism growth. Diagnosing otitis externa is based on multiple clinical manifestations seen in the patient. It is typically seen in one ear but can occur in both. Rapid onset, usually within 24 to 48 hours, occurs. Itching and earache are major symptoms of otitis externa. They are the most common. The amount of pain felt is directly related to the severity of the condition. A person will have a sense of fullness in the ear. Fever is possible, but usually advanced stage of disease is occurring when fever is present. If left untreated, the infection can spread to other parts of the body. Chronic otitis externa may result, which is having the condition for more than 3 months. Necrotizing otitis externa is a severe complication, particularly for people with diabetes. Immunocompromised persons may develop malignant otitis externa, which can spread to the skull base, which causes osteomyelitis, which is a life-threatening condition. Physicians will usually prescribe ear drops to treat otitis externa. Antibiotic eardrops are used to fight the infections. They can be either fungal or bacterial. Ear drops can also be mildly acidic to counter the organism growth. These drops can also be with or without steroids to counter the inflammation and the itching experienced by the person. Oral antibiotics are given only when the infection is severe and has traveled beyond the origin site of the ear. Physicians will usually I'm going to be showing you how to instill ear drops into the ear of a patient with otitis externa. The patient in our case study is a 16-year-old male. I'm going to be using my 10-year-old daughter. Something that I personally would do prior to doing this is I would give her some Tylenol or some kind of pain medication, because we're going to be messing with the ear and I don't want her to have any more pain than she's already having. Okay. First of all, we need to make sure our hands are washed and clean. We need to make sure that they're clean so that we don't introduce any more bacteria into the affected area. Okay. Next, we need to warm up the bottle. We do so by rubbing it between our hands like this for about a minute or so, or we can put it into some warm water. Next, we open the container and we have to test a drop first. If it's too hot, we risk burning the patient and causing further injury to the ear canal. And if it's too cold, the patient can have some dizziness or other neurological symptoms associated with the coldness in the ear. Position the patient on her side with her affected ear facing up. Okay? Put the hand on the patient's cheek. This is the hand we're going to be administering the medication with. The patient is over 3 years old. So what we're going to be doing to open up the ear canal is gently pull back the ear and outward. Okay. We need to visually inspect the ear to make sure that there's no pus or any other liquids coming from the ear. If there's some clear liquid, we can get a tissue and just dry it up just externally. We're going to squeeze the dropper slowly to give the amount of prescribed medication into the ear. Okay, I'm going to have the patient lie down or continue lying down on the same side for about 1 to 2 minutes, just to make sure that the medication goes completely into the canal. If the patient has an infection on the other ear, we would just repeat all the steps, but having the patient turning on the other side. Okay. Now, after we're done instilling the drops, we need to make sure we wash our hands and we put the medication away according to the label instructions. This is a list of the steps presented from the preceding video. According to healthychildren.org, teenagers must keep their ears dry and continue taking their medications for 2 to 3 weeks after the symptoms fade. When showering or washing the hair, they should cover their head with a plastic cap or protect their ear canals with a soft earplug such as a cotton ball covered with Vaseline or commercially available ear pudding. Placing a warm compress or heating pad against the ear will help reduce pain. Analgesics such as acetaminophen or nonsteroidal anti-inflammatory drugs would also help. A patient may not feel much of a change in symptoms until after 1 or 2 days of continued treatment. Symptoms may continue for up to a week. If symptoms persist, treatment may continue for another week. If symptoms continue after that, a physician should be seen for evaluation and possible change in treatment. There are many things a person can do to prevent the occurrence or even reoccurrence of otitis externa. First of all, do not stick anything foreign into the ears that can cause damage to the skin. Do not frequently wash your ears with soap, because that will change the pH in the ear, possibly allowing for bacterial growth. Do not swim in polluted waters, because there can be bacteria that can be introduced to the ear that can cause infection. Place tissue to an ear opening and lean to the side to remove excess water after swimming or after showering as needed. Do not use earplugs while swimming. Ear drops consisting of isopropyl alcohol and acetic acid at a 2-to-1 ratio can be used after swimming to prevent the occurrence of otitis externa. Prevention and education are the biggest interventions against otitis externa. If you have any further questions or concerns, please contact your healthcare provider. Thank you very much for taking the time to listen and to watch my presentation. I hope you have a blessed day. Thank you.